Dr. Zhao cured a lady's prolapsed bladder problem. Hello everyone, today I'm going to tell you another story about my treatment. A long time ago, a lady and she came to me, said she has a prolapsed bladder, and she worked in the hospital, general hospital, theater department, which is do the operations and for all kind of operations. So she's a theater department nurse. Sister, I think she's quite a high-ranked nurse. So she said she had a prolapsed bladder, and she had 2 operations. Tried to lift the blood up, and both operation failed. And then her doctor, I think she worked with, and offered her 3rd operation. She refused. She said it's too painful to do the repeat operation, quite harmful. And then somebody recommended her to me to see if I can help. So let's look at the bladder, okay? So here I have a big book somebody bought for me, and this is the front part, okay? So this is our bladder. So the bladder is like a triangular shaped bag and linked with our 2 kidneys and get the urine, urethra, and then contain the urine, and then until it's full or you sense you need to wee, and then the nerves will open the urine, external opening of the urethra, and then you will empty it. And the bladder connect with our other part, which is behind the rectus, and then the woman's uterus, as well as this in the front. There are a big ligament called the median umbilical ligament. So this ligament quite big, and then go all the way up along the stomach wall, the front of the muscle, and then stop where our belly button is. So this is called the umbilical. So it's linked with our belly button. So it's quite a strong ligament, can hold the bladder in a good position. So imagine, so this is our bladder, okay? It's like a triangular shaped, and this part is lower, and then on the 2 sides, both sides, there's a urine tubes from the kidney, okay? And this part I'm holding here, top, this is like the ligament, which is called an umbilical ligament. If this ligament not working, so imagine the blood can be upside down or falling down. And then what's the symptoms you can have, or somebody have the problem can have, and you want to wee all the time because you feel your bladder is like a full all the time. But when you wee, you cannot empty completely. As well, sometimes you urgent go to toilet because you want the toilet, because you feel the bladder is like alright full of the urine, but it's not. As well as you feel uncomfortable, and sometimes your urine leaking because all the ligament loose and the bladder wall cannot be strong, as well as the urethra cannot be strong, the muscle cannot hold the urine very well. And then when you laugh, when you sneeze, when you're running, or when you're walking, can leaking water out. So the doctor offered to cut the ligament short and then make it tight, let it lift up. But twice it failed. Alright. So what caused this? So the Chinese medicine said it's qi deficient. So compare with the Western medicine, qi explained, I said qi is like your nerve function. Alright. So the qi and blood control everything. Qi is like your nerve, control your ligament, control your muscle, control your all bodies. So that means your nerves is weak. And So what nerves control it? I will show you, okay? From here, we can see the bladder, this is our bladder, controlled by two different nerves. One's called the sympathetic nerves, which is red, and which is controlled by the L1, L2, L3 area, okay? So, or even sometimes T12, L1, L2, L3 area, and then go down, form network, and then go down, control the blood. So the parasympathetic nerve, which is come from the sacrum area. And these nerves more important because these nerves more control the smooth muscle, which is our blood's function. Okay, so it's from the sacrum, low back, sacrum area, and they come out from a network and then control the uterus, bladder, and even the rectus. So these two parts control the nerves. So what I do, I treat all these nerves, as well treat the neck to help the center of the brain, called the brain stem. Part is the brain stem. This brain stem control all the nerves, include the parasympathetic nerves and then sympathetic nerves, and which control the body's autonomic nerves. So I treat the neck and then treat the low back, and then the lady's blood collapsed bladder was cured, and she no more need any operation, and her urine and everything become normal. No leaking, not the urgent and go to toilet, as well as her low back pain is cured. So because she has lots of low back pain previously, and the low back pain cured. So that's a very important case, a very interesting case. So this gives us an idea. So treat the neck, and can help the prolapsed bladder. Okay, thank you for watching. We can see the bladder area and also the medial umbilical ligament. We can see the green line, the median umbilical ligament, go up, all the way up, and stop the belly button area. Here we can see all the nerves, including the sympathetic nerves or parasympathetic nerves, control the bladder, control the ligament, control the smooth muscle. This is Dr. Zhao's 推拿彩条 treatment. Treat the low back area.
We're down a track 14 kilometres.
Oh wow, nice.
And at the end, it's like a hippie shack where you can get food. And it's the source of a river from the mountains.
Yeah.
And so you get in the river and swim.